So this thing, respiratory cells, and you mentioned in your video that it's binding to the ACE2 receptor. So there are many potential therapies in our suite, in our toolbox, that could maybe address this problem. One of those could be something that might block the ability of the virus to bind to the host cell receptor. So you mentioned the proteins on the outside of the virus. They're called the spike proteins. They're the key that gets into the lock of the host cell receptor. And once
does chloroquine block them or not?
Well, chloroquine is definitely one of the things we've been talking about a lot. We actually don't know a lot about how chloroquine works, but it's probably having an indirect effect. It's not actually acting directly on the virus. It might be changing the pH of the vessel that is created around the virus when that lock and key happens and the virus is taken into the cell and begins to start its replication cycle. It's probably affecting the way the immune system is responding to the virus. That's how chloroquine works when it's used to treat lupus, for example. So the danger here is that we don't really know how chloroquine is working.
And where else might we look for therapies to fight the coronavirus? You've talked about antivirals. What exactly are antivirals?
So there's a suite of small molecules that have antiviral properties. And we've investigated antiviral properties in many situations, like for influenza, to treat Ebola, even to treat a relative MERS, the Middle Eastern Respiratory Syndrome virus. And they attack different parts of the virus life cycle directly. So they work very well when they can target a key element in the virus life cycle. The other kinds of therapies that are out there are antibody therapies, and some of those could be broad, so they can generally protect against a range of kinds of viruses, or they can be antibodies, monoclonal antibodies that are specific to a disease.
Now, I've heard a lot of researchers talk to me about, and I'm an oncologist, that one drug is unlikely to be enough. Like for HIV and for cancer, where we have to have multi-drug regimens, we target maybe the binding site, an antiviral to prevent the virus from replicating, something for the immune system. Are we likely to have one drug?
They're very fast evolving. And if you just treat them with one weapon in your armature, they can evolve very rapidly to escape that impact. So in the case of HIV, it's actually a cocktail of drugs that need to be applied to control that virus. In the case of influenza, Tamiflu works pretty well. With this virus, what we would want to do is have a full spectrum of multiple tools in our toolkit.
That is the best discussion I've heard yet about how these medicines work, and I've taken anti-malaria pills many, many times on my travels in Africa, never had any idea how they were working. Shannon Bennett, thank you very much for your expertise in joining this discussion tonight. We really appreciate it.
You're welcome. Thanks for having me.
Thank you. And when we come back, we have stunning numbers from some places around the country, including Chicago, that are showing 70% of the victims of coronavirus are African Americans. Chicago Mayor Lori Lightfoot joins our discussion after this break.
With my hepatitis C, I felt I couldn't be at my best for my family. In only 8 weeks with Mavyret, I was cured.
I faced reminders of my hep C every day.
I worried about my hep C.
But in only 8 weeks with Mavyret, I was cured.
Mavyret is the only 8-week cure for all types of hep C. Before starting Mavyret, your doctor will test if you've had hepatitis B, which may flare up and cause serious liver problems during and after treatment. Tell your doctor if you've had hepatitis B, a liver or kidney transplant, other liver problems, HIV-1, or other medical conditions, and all medicines you take. Don't take Mavyret with anizanavir or rifampin, or if you've had certain liver problems. If you've had or have serious liver problems other than hep C, there's a rare chance they may worsen. Signs of serious liver problems may include yellowing of the skin, abdominal pain or swelling, confusion, and unexplained bleeding or bruising. Tell your doctor if you develop symptoms of liver disease. Common side effects include headache and tiredness.
With hep C behind me, I feel free.
Fearless.
Because I am cured.
Talk to your doctor about Mavyret.
At Fisher Investments, we do things differently, and other money managers don't understand why.
Because our way works great for us.
But not for your clients. That's why we're a fiduciary, obligated to put clients first.
So what do you provide? Cookie-cutter portfolios?
No. We tailor portfolios to our clients' needs.
But you do sell investments that earn you high commissions, right?
We don't have those.
So what's in it for you?
Our fees are structured so we do better when our clients do better. At Fisher Investments, we're clearly different.
And here we have another burst pipe in Denmark. If you look close...
Jamie, are there any interesting photos from your trip?
Ouch. Okay. Boring. Boring. You don't need to see that. Oh, here we go. Can you believe my client Stieg had never heard of a home and auto bundle or the renter's good bundle?
Wait, you're a lawyer?
Only licensed in Stockholm.
What is happening?
Anyway. Game show, Kumite, Cinderella story.
You know karate?
No, Ellen. I practice Muay Thai. Completely different skill set.
Eating better is easy whenever.
There's no time to waste. Let's get your body in the best shape it's ever been.
Woo, you can feel that in your legs too. It's good. Slide the beat and forward. Don't rush it.
That's how you get better. That's how you get stronger.
Kick it up. On the way.
You guys ready to work out? And hit it.
Health departments have been releasing very little demographic information about people who test positive for COVID-19 and the people who are dying after being infected. But some states, counties, and cities are releasing more demographic data that show, in some places, a hugely disproportionate effect on African Americans. Joining our discussion now, NBC News correspondent Morgan Radford. Morgan, what do we know?
Well, Lawrence, we know that this is a crisis within a crisis. If you actually look at the data, it shows that COVID-19 affects people of color at disproportionately high rates and is essentially a ticking time bomb. And what's interesting is that the CDC doesn't actually share the racial breakdown of its data, but certain cities and certain states do, and those numbers are alarming. If you look at the entire state of Louisiana, for example, 70% of people who die from COVID-19 are black people. If you look at the state of Michigan, 40% of those deaths are African American, and that's in a state that only has a 14% population of black people. Then if you look at blacks and Latinos in places like Milwaukee, they account for 78% of the deaths. And if you look right here in New York City, 56% of the deaths are concentrated in the Bronx and concentrated in Queens. And as you know, those are both majority minority communities. But what's interesting about all this, Lawrence, is when we talk to experts and we talk to people who were personally affected by this virus, they point to three contributing factors: health, jobs, and most surprisingly, misinformation. Take a listen.
There was a little bit of like, oh, black people can't get it, right? Well, guess what? Here I am. I got it. Look, I think it's going to get really bad for black and brown people, right? That's just a fact.
I'm your typical average healthy millennial, and this virus had me barely able to stay awake because my body was burning up. I had a winter hat on in my own home. There was so much misinformation being pushed to our community, and people are sharing it out of fear. They are sharing it because they do not trust a number of systems and political leaders that should be there to protect us. If it hurts the white community, it can kill the black community.
So breaking down those three factors, when you talk about health, the CDC says that those pre-existing conditions that make COVID-19 deadly, like heart disease, diabetes, asthma, those are already overrepresented in black and brown communities. So it's not like black people are more susceptible to getting the virus itself. It's that they're disproportionately affected when it comes to those severe or deadly complications. And then secondly, when it comes to jobs, they're overrepresented in those direct contact service jobs. And finally, the CDC had to actually actually create a web portal trying to dispel those myths, things like Black people couldn't get it. So that's why we're seeing those numbers as high as they are, and it's a cause for concern. Lawrence?
Morgan Radford, thank you for your reporting. Today, Chicago Mayor Lori Lightfoot said the Chicago Department of Public Health statistics show, quote, 72% of Chicago's deaths have been among Black Chicagoans, though Black Chicagoans make up just 30% of the city's population.
Those numbers take your breath away. When we talk about equity and inclusion, they're not just nice notions. They are an imperative that we must embrace as a city. And we see this even more urgently when we look at these numbers and this disparity. It's unacceptable. No one should think that this is okay.
Joining us now is Chicago Mayor Lori Lightfoot. Mayor Lightfoot, you must have had a feeling that this was what the numbers were going to show even before the data was assembled with this overwhelming impact on African Americans in Chicago. Do you have any working theory about why it is?
Well, I think the reporting that you just showed, which is when you have all these health disparities pre-COVID, where you've got a disproportionate number of people in the African American community with diabetes, with heart ailments, with respiratory problems. This disease attacks and feasts on those underlying conditions. And that's what we're seeing manifest in the numbers. I mean, it's breathtaking. When I first saw these numbers, I had a hard time thinking about anything else because I knew that this was going to land like a bomb and that we had to come up with some concrete, rapid responses to help people in these communities.
And there hasn't been any emphasis on this or even a word about it, as far as I know, at the White House briefings, which are the most prominent kind of public transfers of information about this. And yet we heard in the report just now that there has been a lot of misinformation out there. Do you have any sense of what kind of misinformation there has been in the Black community?
Well, I think there's been a misinformation that Black people can't actually get the virus. And the truth is, in Chicago, the first reported death was an African-American woman who then gave it to her sister, who then also died. So the numbers speak for themselves. The fact that Black people are dying at 7 times the rate of any other demographic is stunning. It is a red alarm, an alert that we've got to respond to, and we are in our city.
And Mayor, how do you respond to it in terms of public information? What is the message you want to get to African Americans, and how do you deliver that message both in Chicago and beyond Chicago?
Well, what we've done is we've formed a strike force, and it's going to be hyper-local, targeted outreach to people of color, and particularly Black folks in their neighborhoods. We're going to be calling upon the faith community, elected officials, street outreach workers, people in block clubs to get the word out and then connect people up with services. We've been saying, 60 or over, we're going to lower that to 50 or over in the Black community and really focus on getting people tested, getting them supports, talking to them about what they can do to protect themselves. But we've got to reach more people and quickly.
Mayor, how is the hospital system in Chicago bearing the burden so far?
Well, so far, we're okay. We've been tracking ICU numbers overall, the number of people in ICU beds that are tested positive, the number of people under investigation for coronavirus that are in ICU beds. We've been hovering around 75, 76%. Over the last couple of days, it's dipped down to about 71%. But we know that we are far from out of the woods. We're concerned, of course, like everybody is, about ventilators, PPE, and testing. We are not testing nearly the number of people that we should be. And this is one of the tools that we're going to have to employ in thinking about how we reach Black people. We've got to bring more testing to those neighborhoods so we understand what the underlying data really is. And the last thing I'll say is we've got to make sure that our healthcare providers are providing us with the demographic information. As stark as these numbers are, we know that we're missing 20%, 25% of the demographic information on testing that's positive. So we've got to really ignite the consciousness of our healthcare providers to make sure they give us that demographic information.
Chicago Mayor Lori Lightfoot, thank you very much for emphasizing this crisis publicly and helping us emphasize this point that really has not been part of the national discussion as it should be so far. We really appreciate it, Madam Mayor. Thank you.
Thank you.
And joining our discussion now is Dr. Vanessa Northington Gamble. She's a physician and a historian of race and American medicine. She's a professor of medical humanities at George Washington University. And Zeke Emanuel is back with us. I'm just going to get out of the way so the two medical professionals can talk to each other about this.
Dr. Gamble, you have seen these data and you've dedicated your life to erasing the disparities in healthcare between African Americans and whites. What do you think would be the most effective way both to educate the community, to get them to practice physical distancing, and really to wipe away this horrid disparity?
I mean, Zeke, I think the first thing we need to do, and the mayor brought this up, is release the data. I mean, Chicago is one of the few places, Illinois, North Carolina, and Michigan are the few places that release data to racial data with regard to coronavirus. So I think we have to have this information to work with particular communities so that they see their faces. They see their neighbors dying, but at the same time, they don't see our leaders talking about this.
And how should we educate them about the correct practices to protect their lives, really?
I mean, I think, first of all, I think that we have to be real here, because we tell people stay home and social distancing. A lot of people can't stay home. Some of us can, right now, I can stay home and work from home. But if I am working in food service, if I am working in janitorial services, I cannot stay home. I have to, in Philadelphia, I have to take the L. I have to take the subway in New York. So in terms of our messaging, we have to be, when we tell people stay home, and also when we tell people to social distancing. So I think that we have to be very clear with ourselves about what we are saying to people. And at the same time, we have to educate, not just people of color. We have to educate our leaders. We also have to educate medical professionals that this is not just a medical issue. This is a social justice issue. And one of the things that we are now seeing is that we are seeing the fault lines of hundreds of years of social inequalities.
Do you think there's something the medical system can do this moment to sort of treat African Americans better? Is it that they need to go into the community to do more testing and make people aware that way?
Well, first of all, I have to hand it to my colleagues who are in places like the Bronx and Queens, who are on the lines taking care of poor people and Black people. I have to hand it to them. But at the same time, I think we also need to work with communities to find out, what they need. What's the best way? I mean, one of the things that's happening in Milwaukee and also in Chicago is trying to find those leaders within the communities that can help spread the message.
Dr. Vanessa Northington Gamble, thank you very much for helping us emphasize this very important issue tonight. We really appreciate it.
Thank you very much.
And when we come back, we'll get a last word from Dr. Zeke Emanuel on when we might return to normal and what normal might look like. But first, there has been a national outpouring of well-deserved support, admiration, and gratitude for our brave medical professionals who risk their lives every day to save lives in this pandemic. We give them a special thanks tonight with thank you notes sent to them from all over the country and read by the healthcare professionals who received those thank you notes.
Thank you will never be enough.
your tremendous bravery, knowledge, and life-saving skills are not going unnoticed.
These shields were made with love and appreciation by myself and my 2 children, ages 10 and 8. We could not express our care and concern enough for you in keeping you in our hearts and prayers.
Thanks for the sacrifices you have made with the long hours, the time away from home and family. Thank you for your leadership and teamwork.
Every day, nonstop, you are saving people's lives while risking your own. Having no time to rest or calm down. Too busy saving lives to go home and see your family.
I'm so grateful for the few hours out of a week that we're able to do puzzles together or eat dinner as a family. All while you console my fears and assure me that we're going to get through this. Thank you for being the amazing mother and the nurse that you are. I love you, your daughter, Fina.
I'm sure you're scared too. But you put your fears aside and help those people to hopefully recover.
There are real superheroes. Superheroes that save lives from all around the world every day. And those superheroes are you.
And I hope from reading this it could help you find hope, knowing how hard it must be running around the hospital and working overtime to make sure everyone is safe.
I came home yesterday to find this. Dear Dr. David, thank you for all your hard work. This came from a young boy in our building. Really appreciated it.
Nurses, thank you for your work. I love you. You guys are awesome. It touched my heart and it brought a huge smile to my face. So thank you for taking the time to write to us.